Good morning, world. I am Judy, your web-based therapist, making therapy accessible and convenient for our clients in Florida and New York, and of course, sharing information worldwide. Today, I want to take a moment and talk about 5 tips for making mental health services more accessible. Because whenever the topic comes up, whenever you start talking or hear people talk about mental health services, the complaint or the primary concern is usually how unavailable, inaccessible that it is. And it is available, it is accessible. It's just that we don't always know how to access them. We don't always know what the resources are. So that's why today we're talking about 5 ways or 5 tips to make it more accessible to you. But before I get into that, I want to take a quick moment and say, if you are subscribed, thank you so much for being a part of our awesome world. If you're not yet subscribed, please take a moment and click the subscribe button below so you can join all this awesomeness. And remember to tick the bell so that you are notified when I post new videos so you don't miss anything. And of course, if you'd like to purchase 1 or 3 of my books, there's also a link below that will take you to a site that shows you all your different options of places where you could get 1 or 3 of my books. Okay, let me get back to it. First, look at the services offered through your EAP. Most people who have an employer, most people who get a regular paycheck with a W-2 have access to an EAP. And a lot of people are not using it. The majority of people who are eligible to use their EAP services are not utilizing that. And it's one of the most underutilized services, benefits that people have. So take a moment, reach out to HR, look into your benefits portal, see what services, see what options are offered through your employee assistance program. And it can be the benefits can vary so greatly, because it may be that you get 3 sessions, or you could get 10 sessions, or it could be that your sessions are renewable per incident, or they could be renewable per year. There are a lot of different ways that they are allocated, but in order for you to find out, in order for you to maximize the use of, to maximize your benefits, is you need to reach out and find out who is eligible. Is it your immediate family, meaning your children and your spouse, or is it people in your household? There are so many different ways that they are allocated. So take a moment and look into the services that are offered through your EAP. Second is to pay attention to that coverage when you are selecting a medical insurance plan. Most of us now have health insurance, and health insurance in a lot of cases do cover that service. Unfortunately, many people are not, because we're not used to looking for that. Many people are not paying attention to it. Many people are not selecting it. Many people are not taking that into consideration when they select a service plan. And the plan you select can make a big difference, because I have a client whose services are fully covered, meaning that person does not have to pay a copay. There's also another plan that I've seen where the client only has to pay $5 per session. And of course, there are other plans where the client has to pay the full benefit because they are still in the process of meeting a deductible. So it's it varies greatly what services are available through your health insurance, depending on what plan that you select. So if that is something that you're interested in, make sure that when you are reviewing insurance plans, that you look at those benefits as well to see what the plan covers, if there is a limit on sessions, how they are covered, and all those things. 3, create and participate in support groups. In a lot of ways, I once heard someone say that they weren't interested in support groups because they didn't want to sit in a room with a bunch of people crying. But that's not what support groups are. Support groups are a way for people to get together, and people who are going through a similar situation to get together and work through it together, support each other through that journey. And there are so many benefits. One, that from that feeling of being reminded or noticing and realizing that you're not the only person. People in support groups, they're often able to celebrate successes with each other. They get hope from each other. They get motivation and inspiration from each other. And support groups are one of the best. They're so great at sharing resources. So find ways to create some type of a support network or a support group within your environment. And it doesn't have to be in a fully clinical support group. Sometimes it's just a support group to help you and others going through or being in that same space that you are navigate the whatever that space is that you guys are in together. Support groups for whatever the situation is that you are experiencing. You can always find or create a group of people where you guys can work together, support each other, and share resources and just encourage and get the benefits of being in that, get the benefits of that camaraderie, the benefits of that network, the benefits of having people around who get it. 4, explore self-guided programs. There are quite a few of them. One thing that I do notice that people do a lot, a lot of times people go through these big names, these mega church style motivational speakers, empowerment gurus, and things like that. A lot of people subscribe to some of these, but one thing that a lot of these things often lack is that actionable piece, where it's like someone is rah, sis, boom, bye, you got this, that, and the other, but they don't give you actionable steps to take. But there are a lot of great books, a lot of books that are written and developed by clinicians, people who do the work, who can take you through some more of a self-directed or self-guided program to help you address an issue, giving you specific assignments, workbooks, and workbook pages and different things that can help you navigate an issue or a situation. So look into those as well, because they can be beneficial. They are a way, and sometimes they especially for people for whom the cost is prohibitive, a workbook could be effective. A workbook could be something that you get to do in the privacy of your own home at your own pace, and whenever it works for you and however it works for you. Of course, if you're going to select that, make sure that you are following through, because that's one of the reasons a lot of these things don't work, is that people start, but they don't follow through. They don't complete the program. So make sure if you are going to take the time to invest in a workbook or some type of program, that you are actually doing the exercises and following through and getting to the end of it. And finally, find or create opportunities in your community or your environment. A lot of times, the programs we find in our communities were created by someone who realized that there was a need. And sometimes you're the person who needs it and realizes that, hey, there is a need for this. So create programs in your community, your church, your community centers, your wherever that you have access to, that you have a voice. You can bring it up to your church leadership and say, hey, can we do something? Can we have a stress management group? Hey, can we do workshops? Because there are people in the community who will do it. There are professionals in the community who will come and work into a church and do some and teach some stress management strategies. There are people who will come into your church and speak on whatever that topic is, helping the members, helping the community, help wherever it is that you have access to, that you can gather a group. And you can create these opportunities, invite speakers, invite teachers, work together as a group to find opportunities, to find resources and sharing resources. Those opportunities are there, but sometimes it takes that one person to put it together, to say, hey, there is a need for this. So if you are noticing that, hey, I need this and it's not available, how can you bring that or make it available? Because if you need it, there's probably someone else in that community, in that environment, who needs it as well. So if you get the ball rolling and get the program started, now they and you have the benefit of having the resource available to them. Quick recap. 1, look at services offered through your EAP. EAP provides loads of things and people are not utilizing them enough. 2, pay attention to mental health or behavioral health services as you are selecting your health insurance plans, because a lot of plans cover them, but a lot of times because we didn't pay attention to it as we were selecting the plans, we selected one that didn't cover enough. 3, create and participate in support groups, because, hey, it's a great way to have that camaraderie. It's a great way to have people who are going through what you're going through, that you can share things with and learn things from. Explore self-guided programs or books and things like that, like a workbook, because it's a good way to go explore something, work through something at your own pace in the privacy of your own home. And sometimes it can be a lot more cost effective. And finally, find and create opportunities in your community. When you have access to a community where you have a voice, bring these programs, bring speakers, bring teachers, bring people with the resources to share it with you and the people in your community. As always, if you or someone you know happens to be going through something that's more than you can handle, please remember that there are professionals like myself who are available, able, and willing to help, and are even providing remote services who can assist with whatever you may have going on. So please figure out who those people are in your community so that if you need them, you can reach out and get the help that you need. And that is all we have today. Good morning, world. Have an awesome day.